Because of the infection situation, please maintain social distancing and keep your masks on. Use the microphone when you ask questions to facilitate interpretation. If there are no questions, Chief Executive. Good morning, everyone. This morning, I'd like to tell you about two things. First, my visit to Beijing. Two, the development of the infection situation. Previously, I've spoken to you about this, and I said that in order to inject vitality back into Hong Kong's economy as soon as possible, and in order to garner support from the central authorities in terms of economic support measures, the central authorities have been very positive to my suggestion, and they would make arrangements for me to visit Beijing. It's now arranged that I will go to Beijing next week. Our discussions will focus on economic development supporting measures proposed by the Hong Kong SAR. It entails a lot of different initiatives. So I will spend 3 whole days in Beijing next week. After that, I will go to Shenzhen and Guangzhou to speak to the municipality leaders about the development of the Greater Bay Area with Guangzhou and further cooperation with Shenzhen. As far as I know, I will be arranged to attend coordination meetings with relevant ministries and commissions to hear replies to our suggestions. When I am in Beijing, I will visit a number of ministries and commissions relating to our suggestions. There may be some adjustments, so I can't give you specific details. All in all, after the morning EXCO meeting next Tuesday, I will set off. Well, because there is still an infection taking place here, I will have to stay in Shenzhen for 1 night before setting off to Beijing. My itinerary will cover about 4 to 5 days. Apart from myself, I will take with me 5 bureau secretaries with me. There is also the director for the Chief Executive's office. You can guess the secretary for FST, and we have a secretary for transport and health. We have secretary for innovation and technology. We also have the secretary for food and health, as well as the secretary for constitutional and mainland affairs. The second thing I'd like to talk to you about is the latest infection situation in Hong Kong. In the past week, we have seen a stable situation and with signs that are dropping. For over a week, there has been 47 confirmed cases. 90% of them are imported cases. Only 5 of them are local cases. However, out of the 5 cases, 4 of them have an unknown source. Well, as I've reported in my monthly report, in relation to cases with an unknown source, 1 is already too many. The Center for Health Protection has conducted analysis over local unknown cases in the past 3 to 4 cases. They have not found any relations amongst these cases. From their initial assessment, it looks like that these cases are quite scattered in terms of profession, area, and other categories. We can see that the global situation is still quite severe. There are over 42 million cases, especially in Western European countries. We have seen record high new cases up to 10 to 20,000 a day. It is indeed worrying. With winter approaching, in general, viral infection is more rampant. We have about 90% of the cases that are imported cases, so we have to exercise care to try to minimize such cases. Currently, there are already vigorous and stringent measures in place. Still, we will closely monitor the situation to decide what other countries will be included in the specified areas. Altogether, with Belgium added, there are 14 specified high-risk cases. In relation to Spain and Italy, I have had discussions this morning about the possible inclusion of these two countries. In other words, people who come from these specified high-risk areas will have to produce, before they board, a negative test result. Upon arrival, they have to go through a mandatory 14-day quarantine. We will keep updating the list of specified high-risk places. We don't want to leave out any cases. We want to be as watertight as possible. We will take stock of our measures to see if there are any gaps that we need to plug. I said that in the past week, the infection situation has stabilized and there are signs that the number of cases is decreasing. We would like to take this opportunity to review our four-pronged approach: testing, tracing, quarantine facilities, as well as treatment facilities. We have to be prepared as best as we can. To face a possible new outbreak. We have our testing capabilities enhanced. But it's only in terms of the public, in terms of the public sector, 7,000 to 8,000. In the private sector, 70,000 to 80,000. With this level of testing capabilities, we need to find out where we should focus on to reach maximum efficiency and impact. We're told by experts that people suffering from mild symptoms should be tested as soon as possible. Otherwise, they might be an infected case and they might be viral carriers. Currently, there are 46 general outpatient clinics offering free testing services. The distribution hours for sample bottle has been extended. The hospital authority will explore the possibility of extending such a service over weekends or public holidays. We will, as I said, review the situation to see how we can achieve a higher precision in terms of our effectiveness. A lot of Hong Kong people visit private clinics. The private sector plays an important role. I appeal to members of the public that should they have mild symptoms, go to see a doctor as soon as possible. Doctors should strongly advise such patients to take COVID test.
Second aspect of testing is, as you've noticed in our press releases, we have targeted testing programs for targeted groups, and we've started another cycle. Basically, for the targeted group testing program, it's been regularized. So in relation to residential care homes for the elderly and the disabled, we've conducted several rounds of tests for staffers. For drivers of taxis and public buses and minibuses, we have another round, as you would have read in the press release, as well as foreign domestic helpers newly reported to an employer's place. We also have a targeted group testing program for them. The third area is that recently, due to a small-scale local outbreak, we set up 4 temporary testing centers, and they've been well received by the public. For asymptomatic members of the public or those with mild symptoms, they find it very convenient to have local testing centers in their neighborhood. So we're going to set up 4 such testing centers in the territory. Altogether, 4 of them in Hong Kong Island, Kowloon, and New Territories East and New Territories West. The 4 testing centers carry dual functions. First, for members of the public with such need, testing services will be provided by the government. Second, for targeted group or housing estates or small local communities, if need be, we can also expeditiously carry out tests for them. The other function is this. If there is a need to travel outbound for the purposes of using the health code or air travel bubble, some members of the public may need to obtain a negative result certificate, and they can utilize the centers for service at the fee. So we'll set up such centers so that private laboratories offering services for the public can also roll out services at a lower cost. Details will be announced in due course. And there have been many suggestions on a rapid test, and that the result should be ready in 6 to 8 hours. And the Hong Kong Airport Authority will roll out a trial scheme on a rapid nucleic test. Depending on the effectiveness of the rapid COVID test, we will consider applying more extensively to arrivals. Next, on mandatory testing, we are fighting this battle against the epidemic. Of course, we would urge members of the public to exercise self-discipline and to undertake the test voluntarily so that we can reopen the borders as soon as possible and our lives could return to normal. However, we do have a liberal society. Not everyone would act on their own volition. But for the purpose of safeguarding public health, we do require some members of the public to undergo tests. And the relevant work has been carried out under the Prevention and Control of Disease Ordinance. Over the past 9 months, under CAP 599, Prevention and Control of Disease Ordinance, we enacted 7 new regulations. And we're now paving the way for a framework for compulsory testing. However, we need to take a targeted approach. We're not suggesting that everyone in Hong Kong should go for compulsory testing anyway. Well, as we learn from the experience of the Universal Community Testing Program, it needs to be cost effective. And in other words, we are focusing on those with symptoms, those in minor outbreaks, and those in high-risk places and small communities that are under high risk. For example, the container terminal cluster and residential care homes. We are going to soon roll out another piece of subsidiary legislation on compulsory testing. The other area is on tracing. The Centre for Health Protection has been working day and night on tracing these cases with the help of the police. And previously, the Innovation and Technology Bureau started a tendering exercise on developing an app. And I'm happy to report that within this week, on a voluntary basis, users of mobile phones can now download this app so as to record the activities in a day. Now, for restaurants, fitness centers, taxi drivers, etc., would also appeal to these practitioners to install the app and use the QR code so that if a passenger, say, bought a taxi, he can just scan the QR code for the purpose of tracing. Next, on quarantine facilities, work has been smooth. Phases 3 and 4 of the special quarantine facilities in Penny's Bay will be completed by the end of this year. By then, there will be 4,000 special quarantine units available. As for treatment facilities, apart from the 1,100 beds in isolation under the HA, if need be, more second-tier beds will be ready. And at the Asia World Expo today, we have 2,000 beds on standby. It's not currently engaged at the moment because we only have 111 patients receiving treatment in various public hospitals. But if need be, we have 2,000 beds available in the Asia World Expo. And next to it, we are going to build a temporary hospital, and 800 negative pressure beds will come on stream. Work has been smooth. We believe works will be completed before January next year for use by the hospital authority. Finally, on social distancing, the various social distancing measures that should soon to expire by midnight this Thursday and Friday. And on this, we are going to make certain adjustments, but I'm afraid we do not have the prerequisites to totally lift them. And the Secretary for Food and Health will brief you on the details later today. Now, the key word is precision. That is, with infection control in place, how we can allow more businesses and economic activities with precision in terms of infection control, because all these measures have been having a great impact on their businesses. We are a service-oriented economy. For tourism-related industries in particular, I understand that they are bearing the brunt under the current epidemic. It's always been our aim to resume cross-border connections, and we've been sparing no effort. We share the same aspiration as the public. We'd like to resume connections across the border as well. In other words, we'd like to waive the 14-day compulsory quarantine for inbound travelers as well. And in terms of technology, I think we're ready. The technical issues have all been resolved. You can just download a form and then upload the result back onto the website. However, we also need to liaise with our counterparts, and that's the mainland as well as Singapore for air travel bubble. We need to have an agreement. Recently, there have been 2 cases in the airport in Singapore, but this has not affected our agreement with Singapore. We have a good bilateral negotiation process. The aim is that within next month we can introduce the air travel bubble with Singapore. As for the mainland, as a priority, we are going to arrange for Hong Kong residents currently living on the mainland to come back to Hong Kong without observing the 14-day quarantine arrangement. This will happen next month. At the moment, we only have 2 borders operating. That's Shenzhen Bay Checkpoint and Hong Kong-Zhuhai-Macau Bridge. Well, we hope this will give a good start so that in a progressive manner, we can allow people to travel to and from the mainland as soon as possible in the future. Now, I have laid out the framework, and once the measure is ready, the relevant bureau chief will brief you on the details. And that's all from me for the time being. I'm happy to take questions.
Please, we will give you a microphone when you have been selected. I'm from Now TV.